COVID-19 is seeing a brand new concern, the Omicron variant. The variant, which was first reported in South Africa after Thanksgiving, shows a concern to whether countries should initiate more lockdowns or travel restrictions. The Biden administration has put on stricter measures as the variant spreads, asking for international passengers to continue to wear masks and be tested for COVID-19 24 hours in advance to their flight to the United States. The new variant poses a scare for passengers and is the topic for today's episode. Ladies and gentlemen, welcome back to the half hour. As always, it is Spencer.
And this is YuYu.
And today we're going to be talking about COVID, because what's a better topic to talk about than the virus that is unfortunately making headlines of the news every single day. First and foremost, thank you all for the support. We feel so gladly appreciated with everything that you guys are doing. Our last week's episode in the first day, just to give out numbers, hit almost 20 views in 24 hours, which for our YouTube channel is really good. We are very thankful. If you have not subscribed to the YouTube channel, please go ahead and click that red button. If it's red, that means you're not subscribed. That means you need to hit that button and make sure that you're subscribed. Also hit the bell for the notifications.
Ring the bell.
Make sure you turn them on all so you don't miss a single episode. We upload on Wednesdays. So keep an eye out as we continue to post more and more, or well, not more and more, but every week.
Not more and more.
We're busy. We can't do more and more.
We can barely do this.
But yeah, this is a follow-up episode kind of to the Pfizer's FDA approval, which is from what we know, is our numerically best episode that we have done. And it's not just because of that, it's because this really did make a big mark in the news. A lot of people are talking about it. We want to make sure that we give the facts and what's going on. First and foremost, we will link the CDC website just like we did last time in the description. Please follow CDC guidelines. What is being discussed is just both sides of the argument. We ask that you follow what is being guided by the Center for Disease Control and Prevention. And we also are going to be citing some stuff from the World Health Organization in this episode. Just please understand that this is a very big concern. Yes, there is controversy. Yes, there are people that think that this is not a big deal. Yes, there is conspiracy theories resounding around this. Just understand this really is a good topic to discuss. Especially now, I think there's become a little bit more acceptance with it as a concern. But one thing that I really want to note is there is still a ton of misinformation. We just want to present it to you with what's being reported by actual scientific organizations.
On that note, this topic is ever-changing as we find out more and more information about COVID, about its new variants, and about how the vaccine works. So by the time this episode is published, half of this information is probably going to be irrelevant, or maybe half of this information will still contribute to the conversation. But just be wary and know that as an extemper, as a human being who follows the news, always be tracking what's going on, and don't just take everything you hear for granted. Things are bound to change, just like the information we know about COVID and the Delta variant and the Omicron variant.
Absolutely. Now, before we get into the background, we've got some really pertinent information that we have to tell you about today's episode. So this episode of the Half Hour is sponsored by nothing. Are you getting clobbered with all your schoolwork? Is work stressing you out on a day-by-day basis? Then try doing nothing. Doing nothing helps to ease the mind after being stressed out by simple tasks. Nothing is the best solution for helping your mind be free. Take a breather by letting your mind take a brain break by sitting in your bed and staring at the ceiling. Is playing card games with your family not helping you out? Then stop playing them. Doing nothing will will help ease the mind into making you feel more at home. Try doing nothing today. It's better than watching television. YuYu and Spencer do not condone this, but if you feel like it is the best option, then you do you. Anyway, without any further delay, let's go ahead and jump into the topic of this episode. Thank you for nothing sponsoring us, as always. Thank you for no college tuition. So
that's a joke. We are not getting paid. Nothing is not a real thing.
Or is it? Let's go ahead and start. And I'm just gonna give the knowledge as of this recording. So this is being recorded on December 2nd of 2021. This is our current knowledge about Omicron. Okay? So this is to note that there may be some things that are different by the time this is published. The place that is constantly updating on this information is the World Health Organization, that is linked in the sources and in the description of the video. So, due to the recent news around Omicron, it is something that is still widely being studied. Once again, as of the recording of this video, it is important to note that everything has not been released yet, and that listeners, should keep an eye on the WHO for more information pertaining to the Omicron variant. It is unclear how easily the Omicron variant can transfer from person to person in comparison to the Delta variant. It is known that in South Africa that people have been obtaining the Omicron variant much more quickly than the Delta variant. However, this is unclear as to it being other factors that can exist in South African nations and in South Africa. There is no real known knowledge about how severe Omicron is in comparison to Delta. The reports from South Africa suggest that university students are more likely to obtain the disease than other counterparts. Omicron has seen rising hospital rates, but this is not because of Omicron itself. COVID-19 is a severe disease that causes people to become hospitalized. Its mutations are just as impactful. It is unclear as to whether or not Omicron will lead to a rise in hospital rates in comparison to the Delta variant wave. There are a number of studies that do prove that people are more likely to be reinfected with the Omicron variant. People who have had previous exposure to COVID-19 or the Delta variant can be reinfected with Omicron. We understand that vaccines are still the most effective way to prevent the spread of COVID-19. However, there is research being done about whether the vaccines do work against this variant. Right now, we do know that the effectiveness of the vaccines help to reduce severe illness and reduce death. And that's a simple background, okay? That's literally all we know about it right now. It's something that's just been reported about as of our recording last week. It's being widely studied. Something that I should know is it takes weeks for this information to actually become discovered. We still don't have the technology needed to understand the full concept of exactly how a virus works. Studies still need to be taken to understand how it can be transmitted from person to person. That can be done by having two test groups. One group has somebody infected with an Omicron variant, and another group is done with a placebo. That's probably not what's happening, but that's a good example of of a way that it can be studied. There's a lot that we don't know about this yet, and as this topic continues to be understood, we want people to understand that they should keep reading upon it. Look at the CDC, look at the WHO. That helps you out in understanding the context of this. I think this is important for people to understand what exactly this variant is, what we know about it. We honestly don't know much. We know it's a mutation of COVID-19. And from there, YuYu, I think, clearly obvious, this is something that we really ought to take into consideration.
I 100% agree with that. And I think this is one of these episodes where Spencer has a shorter section than I do. But no, like, throw back to the time when we first found out about the Delta variant and we weren't sure about anything about it. We're all concerned. We're all panicking about it. this is kind of like the atmosphere that has like resulted from learning about the Omicron variant too. But this time around, we are a little bit more calm, a little bit more prepared for it, I would say. And we could just get into that. So Omicron obviously doesn't just affect the United States, but after multiple episodes of international topics, we kind of decided to focus more on the domestic effects. So I'll be talking about like the controversies around it, what we're doing about it in the context of the United States and what the United States is doing. So the first case in the US was detected in San Francisco, California, just like a couple days ago, I believe. And now there are cases being detected in Minnesota, in Colorado, and I think even New York now. So it is spreading, it's getting around, but I think it's mostly through like international travel or it's through interstate travel. So the main concern that scientists and officials have with the Omicron variant is the transmissibility of it, the magnitude of the effects / the magnitude of the symptoms of it, and what it's going to do in comparison to the regular COVID virus and the Delta virus. So scientists are not panicking yet. They're keeping a watchful eye on the situation and monitoring as they go. This takes us to what the US specifically is doing about Omicron. Biden has said with his words that they should fight it with quote unquote science and speed and not chaos and confusion, end quote. They are now testing rules for international, or there are new testing rules for international travelers coming to the US, meaning you have to test positive, or you have to test negative, you have to test negative before you can come into the United States. And they're also looking for possibilities of expanding at-home testing, which means you can basically test for free at your home. It'll be a subsidized thing, but we'll see how that plays out, if it passes, what our government is going to do. We are still currently pushing people to get vaccinated as soon as possible, and if you can, obviously. Biden is also pushing for people to get their booster shots, and whether those will be mandated is still on the table. I know Spencer brought up the question of if the vaccine even works for the Omicron variant. They are still pushing for vaccines regardless because the Delta variant still exists, COVID-19 still exists. So even if it doesn't fight against the Omicron variant, at least you're protected against those variants. But I think there is still belief that the vaccine will work against Omicron just because it is a variant of Delta, of the original COVID virus. So it should work along the same ways, along the same lines as those do. So other than that, children between the ages of 5 and 11 are now allowed to get vaccinated too. On top of children, they're also looking at new ways of quarantine or mask mandates in schools and how to deal with the whole integration of going back to school or staying online. That being said, Biden's not really looking towards nationwide quarantine as a solution just yet. They still are proceeding with caution, just not as much caution as before. As long as the variant doesn't infect at a higher rate, bypass our immune systems effectively as the Delta variant, and they aren't, bypass our immune systems as effectively as the Delta variant, et cetera, then they aren't too concerned about it. They're still keeping a close eye. On the other side of the political spectrum, Republicans have threatened to shut down the government on the basis that Biden is pushing for larger employers to get vaccinated and also his vaccine mandate. Other than that, we don't really know what they're going to do about, the subsidized at-home testing kits or about booster shots being mandated. But what we do know is that they'll probably react negatively towards those types of ideas. What's interesting about Omicron and away from politics is that it does do a lot for Delta in that it makes the Delta variant seem like a superhero, even though it's a villain. Mainly, if Delta can hold up against Omicron, with Delta being a stronger variant and a viral infection, then that will naturally ease out the Omicron variant. And all we have to do is focus on the Delta variant. It's just science says that with the stronger virus, that is going to prevail over the weaker virus. So if Omicron isn't stronger than the Delta variant in terms of transmissibility and how well it impacts our immune system, then they're not really too worried about it being something that is big and is going to cause like another nationwide shutdown because it will phase out Delta will, take the crown still. And all we will do is focus on Delta. Then again, it is all a matter of getting people vaccinated to help their immune system protect itself from the deadlier effects of the virus so that it will feel more like a cold or a flu or nothing at all, and like still protect you against the deadly side effects of this virus. Most of what we know about COVID is still in the works of being discovered. Scientists aren't sure if these variants will just incubate in animals and then attack us again in another way, shape, or form. What we do know is that vaccines have been working to decrease the deadlier symptoms and also decrease the spread of the virus, along with mask wearing too.
And I do think it is important to note that even though there's like studies being done with whether or not the variant is successful with the vaccines, or the variant is successful, or the vaccines are successful against the variant, it is still known that these vaccines do go and help fight against COVID. It is really something that we need to express and understand. It's just, there's always that question, and that's something like that's a job that the scientists are supposed to do, right? They're supposed to go out and test whether or not these vaccines are going to be effective at fighting this variant. That we just want to make sure that's clear. You should still get vaccinated for COVID if you haven't been. That's at least our advice. Take what the CDC recommends. If you don't want to listen to us because we're not a credible source, you can look at the CDC. That is something that you should consider. We're just making the fact known that with a new variant, there's still going to be questions, right? And that those questions should be arisen.
Yes. If you do have questions about what we're doing, what the plan for the future is in terms of Omicron, in terms of COVID, the New York Times has a live update on COVID that's also linked. You could take a look at that, but trust in the CDC, trust in WHO, trust in those organizations that are actively doing the research and updating the website. So that takes us to the questions that we have today. I feel like I'm saying too many so's. But anyway, the first question is, will the Omicron variant cause a new wave of COVID lockdowns in the US? And I guess I could start because it kind of is based off of the section that I just talked to you about. I think the answer for this is technically and truthfully no, just because of what we've discovered so far, in that it doesn't seem like it is transmitting at a higher rate than a deadlier variant of COVID. It also doesn't seem like the government is too concerned about Omicron just yet. They are concerned in terms of like what it's going to do, and like the unknown with Omicron is also what is concerning them, but they're not too concerned that they think a nationwide shutdown is required to keep it under control. With what we have so far, we have like people who are getting vaccinated, people who are still getting vaccinated. So they think that that is going to help decrease kind of the spread. So they're not looking forward to like locking down again. And also, just like a little side note, but something that's really important, is that people don't want to go back into lockdown because of all the negative effects that lockdown has caused us. So like economic harm, social harm, mental stability harm, as I'm sure all of you might feel, know, have experienced yourself personally. So truthfully, Omicron variant won't cause a new wave of COVID lockdowns in the US. In other countries, that might not be true. Keep that in mind.
I don't think there's much more to say than what YuYu just said. So I guess like the answer to this is going to be no. Even if it becomes a big concern, I don't know if the government really thinks that it's reasonable with how much people did not like it. And I think the best example or the best way to answer this question is it was not productive for society. obviously you could look at the economic turn of it. Like, even though the Biden administration has said we've created so many jobs in comparison to previous Republican presidents, I think one thing that you have to consider is how many of these jobs did we actually get back, right? And like the lockdown, businesses had to find a way to make money, right? And one way that they could easily have done that, and one way that they did do that, is through, hey, people can work at home, which means that we don't really have to pay them as much. Or, man, having less people here and more technology to do our job is a better option. So it did cause like massive harms. It led to a lot of unemployment rates, as many of us can remember. So many people registering for unemployment. Like, when you like, even though the numbers look like they're decreasing, you also have to remember that unemployment is registered on a 28-day basis, which means that it's only the people that have become unemployed in the last 28 days. So that excludes people that have been unemployed for 2 months, who are considered unemployed in the United States. So there's questions about what the actual unemployment rate is, what jobs have been taken by technology, and so on and so forth. So there's definitely economic harms to this, and having another like lockdown is horrible for the country. You mentioned social concerns. There's a lot of these issues. I'll keep this one broad. I think probably one of the better impacts, if you're going for like a speech or a conversation about this, is domestic violence. Because we did see an increase in domestic violence in the midst of this pandemic, because the one thing that domestic abusers typically, like based off of studies, the one thing domestic abusers want is for their spouses to stay home. And the one thing that the government did in the midst of a COVID lockdown was, well, they told the people that they have to stay home. So it only caused a worse situation for domestic abusers. Obviously, you can talk about the impact in the Asian American community here. But I honestly think that really doing another COVID lockdown is just a horrible idea. It's not that it's bad to prevent the spread of the virus, or it's a good thing to prevent the spread of the virus, which is how you can answer yes. Obviously, we have to give both sides, right? Answering yes to this is a really good, like, it would help prevent the spread. Okay? But honest to God truth, economic problems, social issues, political issues, this answer is just obviously no. Nobody wants to be back in their room boarded up again. Obviously, there increases in depression. I think there's studies saying that suicide rates have gone up. Like, this is a really like important topic, and I don't think lockdown, like, I think the best, now that I'm really like talking through this, I think the best answer is answering no to this because of the social implications. And if I was to give a speech, like my 3 points would be probably the impact on the Asian American communities, then you can talk about depression, and then you could probably talk about domestic violence.
Yeah, and also keep in mind that this question is a will question, so it's not necessarily asking should, it's asking will. And in terms of what the government is thinking about doing, they won't. So we're not going to enter into another like shutdown. At most, I think you could say that you don't know. It depends on how the situation progresses and escalates. If you find new information that has like come out after this episode, or like during this episode's release, then that might be helpful to explaining like Omicron is actually super duper deadly and we have to go into lockdown again because that's the only way to kind of decrease the spread, and that's what the government's doing. Then you can answer like yes. But at the moment, it's either a no or a I don't know kind of answer, I would say. But yeah.
I think we hit that one easily. let's move on to the next question. I think this one will have a little bit more discussion because there's quite a bit of talk around it. And I would certainly pick this question if I was in Extemp because it's really, really good. And I think people want to know the answer to this. And the question is, are travel restrictions an effective tool in the fight against COVID variants? And let's be honest, that's actually a really good question. There's a number of ways you can answer this, and I think I would hope like we would take a scientific approach and say like you can answer yes because it restricts certain groups of people from entering into a country that may be infected with the Omicron variant. So obviously there's a very good scientific answer to that. Here's kind of my thought and my hot take here. I think it's going to spread to other countries anyway. I think that we have a severe problem with travel restrictions effectively working. You could point to New Zealand and like it doesn't really have it's been very hard for COVID-19 to get there. Like they didn't have a case of COVID-19 for like 6 months straight. And then when they got one reported case, the whole nation went in lockdown because it was completely scary for that nation because the nation doesn't want it, right? But even with really tight restrictions in New Zealand, it still got there, right? Which gives me a reason to believe that travel restrictions isn't going to stop this spread. Some nations are going to be ignorant to travel restrictions and flights are still going to happen to get into that country, or traveling on boat will get them to that country. And then you have to remember that people can travel by foot, people can travel by car, people can travel by so many different ways to cross country borders to basically cause the variant to spread. And while I think it's effective in the manner that the question is discussing, because we know it can decrease it, the variant can still get into other countries. And once it gets there, it can start spreading. Like you had discussed, we had its first case, the Omicron variant's first case was in San Francisco. At least that's what the reported one was. It could have been anywhere else, but we know it was in San Francisco, and then it moved to Colorado. We're seeing, as of our recording, we now know that there's been at least 5 people in New York City that's tested positive. So once you have one, you have more than one. And I don't think that travel restrictions are good for trying to reduce it, but I think for eliminating it, they are completely ineffective. So it really depends. It says that it asks if it's an effective tool. I think one thing you should note in this speech is define effective. Are you saying effective as eliminating COVID from coming into the country, or effective as reducing it? I think as reducing COVID variants, they are an effective tool because scientifically they're going to let less people into the country. In terms of eliminating it, they are an ineffective tool because it's going to happen anyway.
Yeah, I think like with travel restrictions and stuff like that, it's been a very controversial topic recently. It's always been a controversial topic, but with like COVID-19 and restrictions on traveling and like banning who can travel to the United States and can't travel to the United States, it's all a big mess, I would say. Just because there's always like this inclination for us to think or believe that there are racist undertones behind travel restrictions and who we ban from coming into the United States. Some of those are warranted, and I would say like the majority of them are warranted to think that way. And so with like travel restrictions, it's a little tough I would say the best way to answer this question is to look at countries who have very strict travel, travel restrictions. So for example, in China, they have very, very strict travel restrictions. You can't go there without a visa process. And now even if you go there, you have to quarantine for a couple of days, whether or not you have COVID or not. You have to be vaccinated, et cetera, et cetera. And for other countries, I think they're trying to shut down traveling too. So for example, EU countries are trying to shut down travel. The UK is trying to shut down travel a little bit more and have restrictions on them. But whether or not they have actually helped to eradicate the variant or eradicate COVID is still in question. But what we do know is that it has mainly helped to kind of reduce contact with the outside world. So there are a couple of ways that you can go about it. You can say yes, and you say like travel restrictions are effective because now we're restricting the amount of people that are going out and coming in which case we weed out the variants or whatever people have from like overseas from coming into the United States. You could also say like, no, it's not effective tool to fight against COVID because even if there was like less travel going on between other countries and us, it's still spread. Omicron still spread. Even in like countries like China, I'm sure we're going to find some Omicron variant cases in China too, even with their strict travel restrictions. And keeping that in mind, it's just all like an indication that it might not necessarily work, and that what we need to do is something that is pointed inward, dealing with our country, dealing with our vaccination policies and stuff like that. It's less about, or hold on, I just want to say that now it is more about learning to live with the variant and less about how do we eradicate all cases. Or not eradicate all cases, but just like how do we keep away people who have COVID? Because COVID is like now all around us. It's a big part of our lives. It's a disease that is just well known. That's everywhere now. So what's best to do is to learn how to live with it.
I don't disagree with that answer. I do think that the coronavirus just in general is it is here to stay. It's very similar to this, like the Spanish flu. Once again, go back to episode 2 that we did on this channel, right? Where I discussed the Spanish flu, etc. We know that the Spanish flu is mutated. Every once in a while we get a flu epidemic or flu pandemic that is similar to the Spanish flu that was a mutation from it. This coronavirus is not gone. This is going to stay. The issue is it is this strain of COVID that is a problem. And that's kind of the discussion point here is we're still in the original COVID pandemic. We haven't like gotten out of it yet because there's been new variants and new there's been new variants. Okay? The question is when COVID becomes kind of just a normal, well, I got COVID kind of thing, right? Or I've got a coronavirus. And then when like there's a pandemic that is like similar to an H1N1 flu, right? That's when it's become more of like we can live with it now kind of thing. Not a scientist, but that's kind of a good idea, a good understanding. So I think that's a good way to look at it. I don't necessarily believe living with the variant is really a good way to look at it yet, because we're still not out of the COVID phase. We're like, think of COVID as good analogy for you people who are looking for an introduction. Think of COVID as a baseball game. Hey, there was a discussion on CNN about this a few months ago. Wolf Blitzer and Dr. Fauci are two very big fans of baseball. Dr. Fauci is a Washington Nationals fan. Okay, which I'm sorry, that's not the best team, but anyway. baseball is a very long game, right? There are 9 innings that last for hours upon hours. Some games, like you can't have the game end in a tie. Okay. So after inning 9, you go into extras until one team has won. Okay. So there have been games in baseball history that have been played for 28 innings. Okay. Baseball is a long game. COVID is the same thing. Okay. The current situation of COVID is now it's bringing in its other players. It's bringing in its bench players. We can think the bench players of like the Delta variant or the Omicron variant now, right? So we're in the middle of the game. Okay, we're not at the end, which is why I can't argue that we can technically live through it yet, because we can't. Um, we're not at that level. I think that it's going to take time for us before COVID is before the game is really over to where it is something that we can get tested for, or just, I mean, we can get tested for it now, but once the game is over, that's when we know we can live with it. I just think now it's bringing in its bench players because there's still a fight for it. There's still a fight against it. The game is still going on. I think that's a good analogy.
Yeah, but also that's not technically what I mean. I mean, like, we're living in a reality of COVID. We have to live with it because it is real. It is very much still a danger, and it's something that we need to like live with in terms of knowing the steps to stay safe, like wearing your mask indoors in crowded places, even if it's like outdoor crowded places, getting vaccinated so that you are protected against these new strains, or as protected as you can against these new strains with the vaccine, et cetera, et cetera. And like learning those steps is part of learning to live with the virus and getting towards the end. So, for example, in your baseball analogy, it would be sitting in these long games and knowing that you have to wait until the game is over to finally accept the fate of your team. But that's what it basically is.
Well, let's keep using this analogy because it's actually a really good one, I think. Because right now we know, using your analogy, right? Let's think of it this way. Okay, I see what you're saying. I'm just making a different point here. We're living with COVID now, okay? Because it is a reality. I'm saying, like, I'm thinking more futuristic. Let's talk present. COVID's now bringing its best players into the game, right? It's bringing in its best offense. So what do we have to do? We have to bring in our best defense, right? So if it's going to have the best players come onto the field to bat and like try to win over us, then we need to play our best defense. And our best defense right now is getting vaccinated, wearing our mask in public when asked to by city officials, following CDC guidelines, right? Think of the CDC as our coach. Like that's an even better analogy there, right? So think of us as like playing, we are on the defense as COVID right now is putting up its best players. We have to play our best defense in comparison to COVID's best offense. So this is a really good analogy though. I'd like to see an Extemp speech done with this. And if you're gonna do it, record it because I want it. Send it to my Instagram.
Very expansive. Email it.
We're having our series on the prep room, right? By this point, the introduction episode should be uploaded. This is a great example of an extended metaphor for people who have been listening to. This is only on one clap, not on the YouTube channel. So if you're watching on YouTube, I'm sorry. Follow us on one clap over there. But this is a really good analogy and a great example of how you can use an extended metaphor in a speech. COVID is taking a very long time. It is like a long baseball game. It is taking a serious amount of time. We are probably in the middle of the game. They are pulling in their bench players. We have to give our best defense now. And once this thing is over, then we can technically live with whatever that just regular coronavirus is. Right now, we have to learn how to live with going against the best players that it's providing.
Yep. I think that concludes our episode on Omicron and an update video. Maybe this video is longer than expected. Maybe it's shorter than expected. But whatever it is, I hope you took a lot of useful information from this. I hope you get the one in the round. If you don't, tell us how you did. Tell us how we did. If you have any questions, comments, or concerns, please feel free to DM either Spencer or me. We're always available, especially from 12 to 3 a.m. Anyway, I hope that you enjoyed this episode. Make sure to subscribe to our YouTube channel. Also ring the bell. Even if you're listening through One Clap, go to YouTube, look us up. We're there. Subscribe, or like go to my Instagram, click the link in my bio, subscribe, and get episodes earlier. Who doesn't want that, right? Like, it's almost exclusive content. Almost exclusive content. But yeah, thank you all so much for listening.
And once again, thank you for nothing for sponsoring this episode. We very much appreciate the support, or the lack of support, rather. But
We'll
as
take
always,
sponsors.
Yeah,
Like Audible, hit
Yeah.
us up.
Hit us up. We're accepting sponsorships. So just send us an email. Even though we don't link our emails, send us an email. You can find us on Instagram. Sponsor us that way.
My email is just my Instagram tag @gmail.com. So
And that's
me.
almost the same with mine. No, it's not. Email YuYu. So you better keep track of your emails.
I try.
Thank you all so much for watching. And until next time, we will see you all later.